Jack and we met January of this year, the first day of January in Nashville,
Correct.
Nashua, New Hampshire. And I also met Laura, and we were all went to Andrew Yan's town hall on the first day, right? And then later we reconnected again. I landed up at,
Sorry.
I landed up at Jack's house in February and stayed with Jack and Laura for 3 weeks. So, can we talk about a little bit about Jack? Can you tell us a little bit about your background and yourself, please?
Sure. So my regular job is more database oriented, but I'm really kind of in the kind of healthcare space, mostly tracking healthcare providers like John and nurses, doctors, and any kind of profession that's related to healthcare. But more, I immigrated to this country when I was 10 years old from Taiwan. My parents are originally from China. But I've been in this country for, I don't know, 40 plus years, I guess. 49 years. So it's hard for me to relate to people from China or Taiwan. I mean, it's more of a foreign country to me than anything. So I definitely consider myself more of an American than anything. I've been pretty much a moderate Republican all my life until I want to say middle of last year when I bumped into Andrew Yang's book and his podcast, which led me to reading his book, and that it's like since that time my life has been in an accelerated fashion because I was so gung-ho about doing everything I can to help promote his message, and not necessarily him, but more of his message, because I think he saw the pieces that is coming towards us and he pieced it all together. So that pretty much takes me up to New Hampshire primary, right? And then after that, we all know what's happening now. We're all in this COVID thing. But if anything, I think this even puts that what Andrew Yang is saying square in front of us in an accelerated fashion. And that's even got me more concerned. Anyway, that's it.
Thank you, Jeff. Thank you. Why are we having a buzzing sound? I was wondering.
I'm sorry.
Oh.
That's Microsoft Teams intruding on my phone.
I see. Sometimes it helps to use a headphone. I don't know if that's the issue. But anyway, so can we? Huh?
Let me see if I can connect it.
Yeah. Sometimes a headphone helps to reduce some kind of weird sound. Yeah.
Okay.
Yeah. Good.
All right. Sorry for being upside down for a moment.
Oh, it's okay. So your device is a horizontal right now, right? I mean a vertical. Oh, you're using your phone. Okay. Is it possible to put your phone horizontal, please?
Yeah.
Okay, so while Laura was trying to figure out her setting, Yang Juhl is my husband, and Ching Juhl, my last name is his last name. Actually, my last name is Ching Chen, Chen. So I took the Juhl last name because it's very pretty. So, Yang Juhl, would you like to tell us a little bit about yourself and how your involvement with us, the connection with Jack and I and Laura?
Well, I started off being a songwriter, an artist, and ended up doing modern dance for 10 years, and then went back to school, got another bachelor's degree, got into a medical school, and and that was 4 years plus a year of internship and 3 years of residency. And I finally came out the other side in about 1992, and I've been practicing osteopathic medicine in the New York area ever since. And my connection to Andrew Yang whole system was through Ching, and she brought home his book, and I read it, and I was really very impressed with the perspective that it had on a lot of the problems that we would be facing very soon in the future. Just the number of truck drivers that are going to be out of work in another 3 to 5 years is just staggering. 3.5 million people, and coming up with some kind of a solution that works for not, if not everyone, at least almost everyone. So I did a little work on the campaign, but nothing compared to Ching and you guys in terms of the amount of effort and time you put in. That's kind of a background for me, and I also, along the way, I taught at the Osteopathic Medical School in Harlem for 8 years.
Wow.
So, and I enjoyed that. I really did. I enjoyed teaching. I see there's a question here for me about the future of medical school and nursing school. I think that there's going to be a crossover point where they're going to have to go to some better national funding for medical school, because these people are coming out with $200,000, $300,000 debt, and that's going to take them 10 or 15 years to pay off before they can start to think about getting a house or buying an apartment or something like that, or starting a family even. So, and I think there'll be a crossover point where you've got one generation that's coming out with this huge debt, and the next class is going to be coming out with much less debt or less obligation. And that's going to be, I think, a really critical crossover point. How it's going to affect demand is hard to say. I think medicine has always been, if not a way that you could become rich, you could at least be comfortable. And I think if we go to some more Medicare for all or the Medicare option or something like that, that it's going to reduce the ability of people to make millions of dollars in the medical field, but I think they'd still be able to have a decent living. And so I think that the demand will stay fairly steady. AI, artificial intelligence, is likely to have a bigger impact in fields like pathology or radiology, where you're basically looking at pictures, two-dimensional pictures, often black and white, and the interpretation of those is going to be very much converted over to AI programs and the radiologist is just going to be a supervisor of the AI arm. But in terms of primary care and what I do, I'm not worried that I'm going to be replaced by a robot. I think I've got at least another 40 years before robots are even remotely close to what I can do, which is literally working with the tissue, and that involves all kinds of inputs that you can't feed through a mic or a video machine. So I think AI is going to have an impact in some fields more than others. But for myself, having thought about that a while ago, I said, I'm going to be okay
Yeah.
in terms of what I do.
Mhm.
And I think that there's still going to be an interest in having some personal contact. I mean, we're all exploring Zoom right now.
Yeah.
But that's just the best that we can do under the circumstances. But I think there's going to be limits on telemedicine.
Yeah.
But that doesn't mean it's not going to take over a big chunk as we go forward. And in those particular fields where like radiology, pathology, uh, are going to have a much bigger impact.
Thank you, John. I would like to continue have us introduce ourselves. I wanted to know a little bit about Laura, please, Laura.
Sure. So I'm actually a New Hampshire native. So I was born here, but I left for going to college because you can't stay in the same place forever. You just have to go out and be exposed to other parts of the country or the world if possible. So I had a couple of stays in Massachusetts, Ohio, and then ended up back in Massachusetts and then back to New Hampshire. So I've actually made a full circle. And who knows where we'll end up retiring. Maybe it'll be up in the mountains, could be somewhere, but probably won't be in a place like we are right now where our property taxes are pretty high. But in terms of how I got here, the story is heavily connected to Jack because he read Yang's book, which I tried to get farther along in than I have, but sadly I have much to catch up with him on that one. But he really became very passionate about the Yang campaign, and I really was tagging along for the ride. I can't say that I was nearly as active as he was. He did phone banking. He knocked on so many doors with you, Ching. So he really put a lot of effort into helping the campaign, where I really spent much more of my time trying to make sure that we had enough coffee in the house, and that if we had an extra person staying for the night, that there was at least an air mattress for them, because I feel really badly for the one person who slept in a sleeping bag on my dining room floor, which happens to be marble tile. So I can't imagine that was comfortable for him. So that's, also something that might be of interest to folks is that I come from a family of Republicans, and though everybody has pretty much changed and evolved over the years in their political views, but was definitely raised to think like a fiscal conservative. My dad was definitely very, very Republican. And then with the current administration is when I joined Jack in leaving the Republican Party and declaring myself as independent. So that way I would be able to have the option to vote in whichever primary where I could make the most difference. So of course I did, vote for Yang in the New Hampshire primary. And it was disappointing when they announced right after the results were coming out that they'd be suspending the campaign. But it did feel like it was a worthwhile effort to support that cause. And I got to say, personally, I met so many people that I never would have met otherwise. And it really enriched my life to meet that many people. Because compared to Jack, I'm definitely the quieter one of the two of us, which is probably good. Can you imagine how loud our house would be if I spoke as much as Jack? It would be incessant chatter. So
yeah, you were the cleaning lady.
Huh.
And then food
Well,
provider.
yeah.
So yeah, it's just so amazing, you guys. By the way, Jack Chen is husband of Laura Chen, in case you could not figure it out, which I I doubt it. So they so I'll tell you a little story how I landed in Jack's house. It was not really planned. I want to go to New Hampshire to canvassing after I went to 2 weeks in Iowa. I really want to stay there longer, but it's just a little too far away. I have business to take care of at home. I have teaching to do. So after 2 weeks in Iowa, I came back, and then in back of my head, I know I want to go to New Hampshire because you are closer to New York, right? It feels like I can just drive there. I don't have to fly there. So eventually, after like a 4 or 5 days rest, I maybe 4 days left. So I just contact the office, Yan office in New Hampshire. I say, I'm coming, and can you find me? I didn't even say, can you find me a place? I don't even remember. I was just, I'm coming. I was gonna stay in an Airbnb actually for first night. So anyway, I drove there, and then I contact again to Brandon, and I said, do you have a place? He said, okay, let me make a phone call. So he made a phone call. 15 minutes later, he gave me your address. Then I just drove to your house. It was 9:30 already p.m. So anyway, so I got there. I was just gonna be there like for 2 or 3 days, I think, like for the weekends. Yeah. And then you set me in your study, set me a really comfortable single bed, very nice. And your cat loves me. And your dog is so lovely. So it was just like, it's so comfortable. And it was like, oh, I'm not going anywhere. I'm staying.
Yeah.
So anyway, so I witnessed the way you work. You're like a shepherd of a canvasser. You whip us around, say, hey, go, you'll go now. Now we'll have breakfast, then we go. So
Right.
we lots of young people there, and we go. I went to many canvassing with Jack, and then and we go shopping, and you feed us. It's just so amazing. You're so generous, both of you, and with your time and your resources, and to all the young Yang Gang, except me. I'm their mom. So anyway, yeah. So it was that's how I met Jack, and then I should check my YouTube channel, Juhl Media. The same thing. There is a film I made. It's called Who Is Jack? So
Yeah,
so
that was a great piece too. I have to say, thank you so much for doing that. It was just really wonderful to be able to reflect back and to just relive parts of those journeys, especially the parts that I couldn't see because I was back here at the house while you guys were out braving the elements of New Hampshire.
oh yeah, there's a lot of good stuff, right? And some singing going on, and some chanting going on. And I tried to get you, Laura, but you're very modest. Yeah, you didn't let me do too much shooting of you. I only got a little bit. But anyway, so yeah. So Laura, earlier you were mentioned you had when you have a question, just spoke out loud, okay? Just so people know what question we have. So you were mentioning about what is the concert, what do you say, the performance now because the COVID, how did you say the whole phrase? Like you were mentioning about performance concert.
Sure. So what I'm thinking about is what will be the new normal for live performances, especially large venues like stadium performances or something indoors at Carnegie Hall or any of the symphony venues. You could pretty much Verizon Wireless. Sorry, it's not Verizon Wireless anymore.
Oh, they
It
changed?
used to be. Yes, it's the SNH Arena now. Plug for
Oh.
SNH about the name rights to our local indoor venue. So, and because I feel like people had a lot of just satisfaction and enjoyment out of going to really big events. One of the things that I dragged members of my family to were concerts at Gillette Stadium. As I would come across a pre-sale deal where I'd be able to get tickets at a reasonable cost, not the scalped cost. And so I made them go see Coldplay with me twice, and Jack was the one who went to go see Taylor Swift with me.
Wow.
Yeah, the kids turned me down. I'm like, hon, you got to come with me. I'm not going to go by myself.
Wow, good for you.
Yeah,
Wow.
he definitely gets Husband of the Year points for that. But you know, I really enjoyed being in those large venues, and it's just such a different kind of experience that right now would be pretty dangerous to engage in, even if anybody were offering that kind of performance. Well, I'm sure somewhere in the world they're able to do it. But that also made me wonder, okay, I bet South Korea is still continuing to support all of those K-pop fans with concerts, or they should be ready or much more able to than but in this country. So my goal is, all right, let's see what are they going to be able to do, and what can we do? Because that would be a pretty huge void to never be able to see a concert at Gillette Stadium like we used to. I mean, that would really be a big bummer.
Yeah.
Are you old enough to have had measles parties when you were a kid?
Oh my gosh. I do remember hearing about those. And no, instead, I got to enjoy getting mumps from my siblings. Yeah. So there was definitely that. But I frankly, I'm a little afraid to be exposed to COVID. Like,
Yeah. I thought of it first as a joke, you know, that you're having COVID parties like at Mount Rushmore, you know, with all the Trumpsters.
Right.
And
for Alabama.
And then they went ahead and did it. And I'm thinking, well, okay, you know, we're supporting free speech and the right to, you know, to come together, and they're doing it voluntarily. Is that going to have a significant impact on the you know, the votes in some of those swing states? I don't know. You got to look at the silver lining of that dark, clamorous cloud.
Well, that's very evil.
Okay, so let's lighten it up a little bit and say that it's very important for us to be able to share music across the community in our future state. And you know, what's that going to look like? Is it just not going to happen until after we have a vaccine that enough people want to
That's a good question.
leverage so that got some kind of protection? Or is it that all concerts will forever be outdoors from now on? Or maybe not from now on, but something like that.
I got a lot of musician friends, and they're all just starving, dying to get back together and play in a local club, or, you know, do a concert or something like that. I think that, you know, apart from the vaccines, that they're going to have to come up with an acute drug. It's not like we don't have a lot of antiviral drugs already. One that works for COVID, so that if you do get it, you can do something. You can get something to deal with it right away, because the vaccine's not going to be 100%. You know, if it's 50%, that'd be great. But it's likely that it would work better on a 12-year-old than on a 60-year-old. So that's the other piece that we need to fit in the puzzle, I think.
Or how rapid testing? I mean, if the White House could get tests.
Yeah, that would be nice. Yeah.
Yeah. Of course, if we could do that for COVID, what else would we want to do that for? It'd be, I'm sure there'd be an easy list of 10 sicknesses that we'd like to be able to have rapid tests for.
Yeah.
I mean, we've got them for strep.
We got it for strep. We have it for the flu. You know?
Nick is here. Hi, Nick.
Hey, Nick.
Hey, Nick.
Hi, Nick. How are you? Sending Yang Gang love from CT. So
I was-
sweet.
Oh, he's in Connecticut now.
Yeah. Yeah.
Very good.
So people can watch us from different places and they can make a comments on the common area. Yeah.
But now, Ching,
Yeah.
we can't text back to him, right?
Yes, you can. Can you?
How
I
do you
don't know
do
if
that?
you can. I can. Like on
Oh,
my
you can. Okay.
I can also
Got it.
bring his comment to here underneath us. So but
Oh,
I'm not sure. Probably, yeah, because I am the host. That's
Right.
why I have that feature. So
Got it.
I said hi, and then I can bring myself to here. See?
got it.
Hi. Yeah. Okay. Yeah. So that's pretty neat. Thank you, Nick. So now, Jack, you had a question for John earlier.
Yeah.
Telemed.
What's that?
Go ahead.
Well, this is maybe kind of out there, but because I had my work involves when it comes to doctors, I have to know which are you? Are you a DO versus an MD? And I always, because it's very difficult because unless they sign their name or their suffix, they wrote it somewhere, the MD, I can't infer. I know it's 90 to 10, 90% MD, 10% DO, roughly speaking. But I want to know, is DO kind of dying in the sense that med school are all teaching? Are they converging into more?
Actually, the number of osteopathic medical schools has doubled in the last 20 years. There's
Okay.
now 30. When I went, there was 18 or something like that, because they're perceived as being a better training for primary care, which is an area of general weakness throughout the country. So by encouraging an osteopathic medical school in a state, they can expect that they will get some benefit in terms of more people going into some primary care, whether it's family practice or pediatrics or even geriatrics. There's not enough practitioners out there, but the reason that the osteopathic program is more attractive is that it first of all it teaches us all these different manual techniques so that we can work on the body, and the focus is slightly different. DOs focus on trying to facilitate the body's ability to heal itself rather than treating disease, which is the allopathic model. You find the disease, you give them a drug, and hopefully they get better. But they don't have a number of those different tools that allow osteopaths to interact with their patients in a more holistic way.
Yep.
And so for telemed, for me, it's kind of like, if I really I do it, but it's certainly not on the top of my list. It's down around number 9 or 13, something,
Right.
because it limits what I can do, and I know that a lot of doctors that are working, that are coming out, they're expected to see a patient in 10 or 12 minutes, and then to write the electronic medical record note, that might take 10 or 12 minutes. So they're either spending a couple of extra hours after they've seen patients to clean those all up, or they're reducing that patient time to, okay, you have hypertension, here's your blood pressure, here's your medication, see you in 6 months.
Right.
Not a lot of time to find out about what's going on in a person's life, and
How long?
and
How much time? How much time you give your patient first time?
first time, an hour.
Wow.
and follow-up visits are 40 minutes.
Wow.
I'm very greedy.
That's awesome. I think that's a dying trait. At least my experience has been, you
Right.
know,
Yeah, I'm lucky. I'm not 20 years younger, but at least the way the billing situation works, and it's changing constantly. I can make a decent living, seeing 10 or 12 patients a day at 40 minutes a pop, um, and I get to cover a lot more ground. I give them nutritional programs. I plans for their second half century. You know, that's
yeah.
I need
that's
that.
one of the things I pitch.
I've crossed over too.
Yeah, uh, and I keep track of a lot more things than I think most physicians have time to do. Or like if I get these electronic medical record notes and they're 8 pages long for a 15-minute visit, and yeah, oh, I need this, I need that. So there's a lot of improvement that needs to happen as we go towards a more coherent system. Something like what they have in Scandinavia and Taiwan and Japan. And
Taiwan is doing so great for COVID. Like I even just yesterday I saw a Facebook post by a famous violinist, Chao Liang Ling. Do you know Chao Liang Ling? Ling Shaoliang.
No.
Okay, Ling Shaoliang. He's quite famous Taiwanese violin concert violinist. Okay, so he's my Facebook friend. Not that he's really my friend. I mean, it just happened to be he's my Facebook friend. So he said he went to Taiwan. He was being quarantined. They actually like provided an apartment for him, like lock him up for like 2 weeks and even give him a whole basket of food and supplies and stuff like that. So I heard really great things about Taiwan, how little COVID case is in Taiwan, and they're doing a really great job.
Yeah, I saw a YouTube video on that as well, and I spent some time in Taiwan. I could definitely see. I mean, they took like SARS and all the other two COVIDs prior to that very seriously. They had protocols in place, and they just initiated and I think they used the culture to their advantage. You know, they made songs, they made it into a game, it's fun, and people were much more socially accepted. Well, I think in general, because whether it's in China and Taiwan, there's more pollution, and they generally feel comfortable wearing masks because without a disease, 50% people are already wearing masks on mass transits anyways. So it was not hard to go the whole way,
Yeah.
And I think they probably have a lot less internal divisiveness, maybe in part because there's this big Goliath, across the street, that maybe enhances that sense of unity, among the people on the island.
Yep.
It just seems like they're very organized, and they are, people do things according to the rules. And because it's such a small area with so many people, can you imagine if they don't do well, it can be a huge disaster, right? Because they're
Right.
just so decongested in Taiwan,
Exactly.
Yeah. So I have a question for yeah, Jack, when you talk about medical things with John, can you tell John what exactly you do, please?
Well, my jobs actually could be summed up in one statement. I basically track all the state licensings for all the healthcare professionals. Obviously, the doctors, the nurses, the physician assistants are the kind of like the queen bishop and and rook of the of healthcare, right? So, but and that's one of my things. I mean, I don't know why it is we have doctors saying, "Oh, you're practicing in Connecticut and New York. You have to get licensed in both." I get the fact that they want the revenue for licensing, but if you look at subtle differences in their regulations, it's like, are you serious? It's like people are people, right? I mean, this is kind of what Andrew Yang is saying. It's we need to think that through from, let's go back to first principles, try to figure out why do we do this? Is it just for the money? I don't understand.
What did you mean by cancel culture?
Oh no, that's a separate topic. So that's definitely another topic I was hoping we could talk about. I mean, it kind of started with the Me Too movement, right? But now we're at a point where a Goya CEO may come out, so now we're going to cancel Goya. It's like, we're using the mass media to suppress, even though I think that's heading down, to me personally, it's heading down the wrong path. We need to have discussions to have debate and social civil discourse. It's very important. That's a fundamental principle of the strength of this nation, and we're going down this path where it's easy to just hit a dislike or like or slam somebody on social media, and then next thing you know, everybody's is that truly your view? I don't understand, and I'm very concerned about that. And I wanted to kind of get other people's thoughts on that too.
Now, I have a question for Laura and Jack. So you have done tremendous work for Andrew Yang campaign. Have you met him, and does he remember you? And what is your impression of him?
Well, I definitely watches everything that he has out there. I mean, I can't get enough. Sometimes I watch it again. I have to be careful. I kind of idolize him in the sense that to me, he's a very brilliant person. He's, not just that, but, it's very hard to have all those attributes where he's about the most empathetic person you can find out there. And he's brilliant. And he reads fast, and he listens well. It's like I can't find anybody like that in politics. So, yes.
Mm-hmm. So, what do you think? Tell me how you felt. I know I have asked you before. We both at the same venue when he announced he's what do you call suspended? Yeah. And you were so gracious when I interviewed you, right? Like 10 minutes after that, you were so positively talking about. And were you bullshitting to me?
No, I think well, first I forgot. So I don't know if he remembers me. It doesn't really matter in the sense that, but now what was I saying? We're talking about.
You were saying we Asians, we'll come back.
Oh yes. So where he started is so low. I mean, in terms of if there was a metric, our politics is way down here, and he's trying to leapfrog us up here, and he did a lot already. He already changed so much. There was nobody talking about UBI. Nobody was even talking about humanity first. And look at where we are now. We're all in it, where we all need to practice humanity first. Wearing a mask is about the simplest thing you can do to respect others, and we can't even get past that. Let alone other things that we're talking about, getting vaccines out, and then some people say, well, I don't want to get a vaccine, I'm against vaccines. And it's like, well, we can't agree on that. But it's more about how do we respect each other and live together. And the world's plenty big for everybody, in my mind.
Yeah. So what is the currently? So Andrea now has done a lot of things, right? He never really disappeared after his suspension, and he started his campaign, become the
Humanity Forward.
Humanity Forward, and he has a podcast.
Yes.
He also has a channel on YouTube, and
Yep.
so do you see he will come back 2024?
I like this. I'm hopeful that somebody in the Biden administration will tap on his shoulder to, hey, get in here and let's, because like I said, he gets it. He understands from the entrepreneur side. He gets it from the AI side, and he's empathetic, and he wants this to be as less painful as possible to this country. And not to mention, he has a good pulse in terms of what's going on in Hong Kong and Korea and Taiwan, because he has, I think that's, we are focusing a little too much on Russia and not, and taking our eyes off the ball in terms of the southeastern seaboard, of Asia there. And that's got me very concerned. I mean, I watch 60 Minutes Australian all the time, and they have a lot of specials on what's really happening in terms of China's, warships just cruising around and saying, "Oh, we can come in here. What are you gonna do about it?"
Mm-hmm. Yeah. Now, in a different note, I'm married to a white person, and you married to another white woman. so Laura, when you first brought Jack home, does your parents like say anything, or they very welcoming him?
So my parents are very very open-minded and not really bound by social expectations that I would have necessarily picked somebody else who was Caucasian to be my life partner. I think the only comment I really remember back then was my dad saying, just know that it's going to be a harder path being an interracial couple than you would have otherwise. And just go into this with your eyes open. And, definitely we've had different experiences depending on where we've lived in the country. When we were in Ohio, we were in the Cleveland area, and the town we were in was racially pretty mixed. And we didn't run into any kinds of really biases or odd questions there. It's been much more accepted in New England, where we've run into a couple of instances where we'll be in the grocery store and we'll go into line together, obviously got all our stuff in the same shopping cart, and they'll ask if our order's together.
Laura, sorry, Laura, to interrupt. There's a funny sound going on. Do you have your headphone? Do you have your headphone?
So
No?
yeah, but the headphones need to go disconnected from the TV. So
okay. I hear gotcha, 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 gotcha.
Yeah, I do too.
Okay. Is that any better?
Yes.
Oh, better, yeah.
Yes.
What was
So
that?
it might have been that microphone.
No, it's come back.
It's back.
That must be Mona. Is it Mona? What's your dog's name?
No, it's not.
No, it's not Luna. I'm hearing the birds. Got the birds.
Okay.
I think it's definitely you, Laura. Maybe.
Yeah. What happened with your headphone?
Um,
No, it's not good. Okay.
yeah. I would have to like go walk to the other end of the room, which I could do to disconnect it from a device that.
Yeah, why don't you go do that?
Okay.
Huh? Wait, hold on. I'll just move you. Oh, yeah. Okay. I'll just remove you right now. Okay. Come back. Yeah. Go get your headphone, please, dear. Yeah. Yeah.
It's funny. We were in Walmart, I think 2 days ago.
Yeah.
The same thing. It's like the woman says, you know, that woman's already put her stuff down. It's Laura right behind me.
Yeah.
I was like, we're together. No worries.
I see. Here, Nick, we still have to hear weird sound, huh? Nick says, cancel culture is a slippery slope. It eliminates the possibility of disagreeing respectfully and or finding consensus.
Absolutely, Nick.
Interesting, huh? Yeah.
Right on.
Here we go. Okay, so Laura is back.
Not yet.
Oh, okay.
Hold on.
That's okay. So John has to leave at 5, right? You have a patient. Yeah. Oh, maybe you could just treat your patient in front of us, you know?
Well, I'd have to ask.
Yeah,
That's
Just
some
kidding.
hip.
HIPAA would take away.
Just kidding.
But as far as the COVID thing goes, I don't know if I sent you guys this. I wrote something called How to Stay Healthy and Sane in a Pandemic World. And we can get it out to you, but it goes over, you know, you want to at least be taking vitamin C and vitamin D every day, because that's going to improve your resistance to the virus. And I talk about a couple of other things nutritionally that you might or might not do, and I kind of broke it down by what your risk is. Are you at a low risk, higher risk? Are you COVID positive at home? Are you COVID positive in a hospital? You know, what things you might want to look into in terms of, you know, how to deal with that. So we'll send that out to you.
What do you mean by that, John? COVID positive at home versus COVID positive other places?
Well, let's say you get COVID, you know, you go get a test and it comes back positive, but you're just quarantined at home, and hopefully you're going to get through 14 days and have a couple of bad days, but basically you're going to be able to breathe and it's going to be like a bad cold. But if it gets bad enough that you're having trouble breathing, then you might end up going to a hospital. And so the interventions that you would do or think about doing at that point are be different than what you are at home. In a hospital, you might be thinking about getting IV vitamin C, whereas at home, you just might double up on your vitamin C over what you might take on a daily basis just for general health and prevention.
Got it. I understand what you mean now.
So I kind of broke it down like that. There's some natural killer cell. There are some things, the substances that seem to have an impact on improving natural killer cell function, which is a subset of your T cells, and you can actually measure that function. And then I've had enough experience where someone had some issues medically, and we checked their natural killer cell function, and it was low. And then they took this supplement, and their natural killer function increased when we retested, which in and of itself doesn't necessarily mean anything unless it correlates to their feeling better or getting sick less often, so that they get a clinical benefit as well. So when you see both a clinical benefit associated with increasing that measurement of natural killer cell function, and then you have to say, well, that's probably significant and valuable. So those are things that are in that. We'll send it to you.
Okay, thank you.
Yeah, are you good, Laura?
she's getting there, I think.
Okay. So Jack, do you have any questions related to can I say 就是你要做那个手术，就是那个 hip
Oh,
手术。
Yeah, sure, definitely. Yeah, like
Yeah, Jack has a operation next week.
next
Oh
Friday.
yeah, gonna get a hip replaced.
Yeah.
Yep.
Do you have any
Okay.
concerns or do you have any question for John about that? No, you're good.
Here's
No.
a couple of things to confirm. One is you want to confirm that all the charges will be covered by your insurance, that you're not going to get a separate bill for the assistant anesthesiologist who doesn't do your system. So you want to get that clear.
Okay.
You ought to know whether they're doing an anterior approach or a posterior approach.
Anterior.
Anterior.
Yeah.
Okay,
4 inches.
That seems to be slightly better, but a lot has to do with what the surgeon is familiar with and comfortable with. You don't want to be the first person he does an anterior, approach on. Maybe the 20th, but not the first. But generally, the anterior approach seems to be slightly better in terms of recovery time.
I think the only
those are the two things that I thought of.
Yeah. But the thing that I'm concerned with is, how long does it last? Is it 10, 15 years? I'll be back at it again, or will it last for my whole second half of my life?
They say, they've got, maybe 15, 20 years. But I think a lot of that depends on your activity level and on your bone health. The only other complication that I've seen that is that maybe 1 in 100 or 1 in 200 people have a reaction to one of the metals that are used in the prosthesis, and there's just no clear way to rule that out in advance.
Wow.
I had one patient who had problems with the prosthesis staying loose, and when we tested her blood, she had high levels of chromium. So ideally, the prosthesis would be mostly titanium and ceramic because that's the least reactive. But the chances are, I'm going to guess somewhere between 1 in 100 and 1 in 500 that you're not going to be reactive to any of the other metals in there.
So what do you do if there isn't a reaction?
Well, this one woman had the prosthesis replaced about a year or so later, and she just was uncomfortable for a long time after. And then I did a couple of blood tests, and they came back positive, and then sent her back to hospital for special surgery, where they do revisions and have a very low rate of infection in the whole hospital, and she's been doing fine since then. But I say that's a rarity.
Okay.
But the prosthesis least likely to be reactive is one that's totally or mostly titanium.
So when you were saying before, in terms of your activity level, so the more active I am, the better or worse in terms of how long it will last?
Well, I think to a certain level, some level of activity is good, just for all the other health reasons. But if you were going to go out and run on cement 35 miles a week, for the next 10 years, that might, wear down the ball joint prosthesis a little faster. I don't know.
He's a tennis player.
I know. That's why it's very important for me.
Well, that should be okay.
Okay.
Yeah, you're gonna play tennis for a couple hours a week,
Well, it's more like a couple hours, 3 times a week.
Right.
But so here's the other question I have. Obviously, both of my hips needs to be done, and we're just starting with the left. How soon should I consider doing the second one?
When you get to the point where your right hip is starting to interfere with your ability to do normal things, whatever that list of things is.
Right.
Because you never know that at some point along the way we may figure out how to inject cells to rebuild the cartilage in place. It's not completely unreasonable, and with the rate of exponential rate of information growth and things like that, it's not. I think if I can imagine it, then it's quite likely going to be possible. Whether it's in 2 years or in 10 or 15, I don't know.
I like that. But you can't put my original hip back in, though.
Yeah.
Those are gone.
Us the deals are not a fan of cut you up. They
There are deals that are surgeons, and I'm not opposed to surgery when you get to a place where it's the best option in order for you to be able to function more in a normal way and do normal things.
Right.
But I would say that there are probably people walking around on 30-year hip replacements, but they usually say is 15 to 20, something like that.
Mm-hmm. That's not bad.
Yeah.
Yeah, you have to go. Or is it somebody knock on your door?
They haven't yet.
Okay.
But,
so anyway,
it's good talking with you guys.
Yeah.
Yes.
Great talking with you too.
And we'll try and get you out how to stay sane and healthy in a pandemic world.
Thank you. I look forward to our next dinner.
Yeah.
Yeah. Next time, hopefully, we can see each other either in your place or our place. We could do a hot pot.
Yes.
Right. We almost did it. Yeah. So John, I let you go. I'm gonna talk to Jack and Laura just for a few more minutes. Okay.
Okay. Bye.
Bye. Thank you for being with us.
Stay safe.
Yeah. So anyway, So earlier, let's go back to a couple of people. Peter made a comment earlier, says something. We were talking about safety issues with vaccine needs time.
Mm-hmm.
So he says safety needs time to uncover. And then Peter is a hardcore Yang Gang, New York Yang Gang. I don't think you met Peter.
No, I have not.
Peter's very supportive of me and of many things, Yang Gang thing. There is no way to fast track safety studies. That's what he said. He's a math professor.
Oh, really?
Yeah, at CUNY. Yeah.
Yeah. I love math.
Yeah. So anyway, any other question, Laura, you want to ask me? Do you have any?
Right. Well, actually, there's a question that you had posed to me that I didn't yet answer.
Okay.
So that was going way back to the question about Andrew Yang and whether he's remember us. And I really felt like during the campaign that he got to a point where I think he'd seen us enough times that we seemed familiar. So it felt like he was remembering us in those instances, which was definitely really nice. Now that there's been the time that's passed and so many new adventures that he's moved on to, not so sure that he'd recall us quite so quickly. But then again, he is a sharp guy. So speaking to my impressions about him, I'd say he's really courageous. That he's been willing to be vocal, to advocate for different paths than what the rest of the country has been, or most other politicians have been talking about when it comes to the growth and the continuation of the country. And I got to say, he's got to be one of the most patient people I think I've ever seen. Is when you look at what his what it's like to be in a home environment where you have a child that really takes a special skill set to work with them. There's that's another breed of person that is able to be so consistently positive and supportive for that child. And what we've seen during podcasts or YouTube videos where he's had family members in the area, or even I think there were some times when the kids were on the trail with them, and he just consistently showed what an incredible parent he is to this child. And that's something that's always really impressed me, because it definitely takes a lot of patience to be a good parent. It's like to the end of the world. That's definitely that I've always thought about, that, boy, we could have all parents be able to keep their composure as well as he does, and to always be looking for the best interest of his kids. It's like, that's rock solid.
That is so true.
Right.
Well said.
Speaking of parent, I have one son, and it's so much work. You have 3 children. How'd you do that? Would you like to share a little bit about your experience of being a mom and that?
Oh boy, to come back to haunt me. What's interesting is that I was always raised to expect to have a career and to not necessarily spend my adult years at home caring for kids. And we were actually married for almost a decade before we finally started to have kids. And then once we did have them, that was when I left the workforce for a period of time to go home and focus on the 3 kids. It gets to a point where the cost for the daycare or the number of doctor appointments for not just wellness visits, but every ear infection or throat infection, it gets to be sort of ridiculous. So there was a time when I just went home and worked with them. And those were the toddler years, which I think are really, really demanding on maybe on introverted folks like me. Because that was definitely one of the hardest things I think I've ever done, is to work with small humans that communicate in a very different way and have just a different set of needs, and they just never seemed to sleep when I wanted them to sleep. so yeah, with all the years of sleep deprivation, that definitely took a toll on me. But then I actually started to work my way back into some sanity by doing volunteer work with a school district. And that was really, that did save my sanity, because it just gave me something else to be able to devote some of my energies to that wasn't quite as challenging as raising kids. Then I did go back into the workforce full time, and have been in IT for over 10 years now. But
you were trained as a lawyer.
Oh, right. Yeah, that's true. That's something I don't really talk about a whole lot. I did go to law school after college, and it was a logical thing to do, because being a double major in Latin and political science.
You want to say something?
What?
She pulled the Andrew Yang. She practiced law for a few months and said, "This is not right. This is not what I want to do."
Maybe be a slightly different strain. So I worked in publishing for 6.5 years, and I did need my law degree for that. But it wasn't like a traditional practice of law. It was like being on law review, but being paid. So that seemed like a pretty good deal. And I got to work in an office environment that had pretty much normal 40-hour week, not the insane kind of hours that young lawyers typically face at big law firms. So that path suited me. a little bit better. So I did make use of the degree, and then I was actually happy to just put it to the side and move on to something else, because there's always something more to learn, which actually is something that attracted me to law in the first place, was that you're always having to learn about something new because you don't know everything about every problem that somebody is going to bring to you. You have to constantly be ready to teach yourself about a whole new area. So that, was useful for a period. And then I was glad to be able to have an opportunity to move into some other areas.
Nice. So your kids, they're all grown up now. They all finish college, right? Oh, still, two of them. Okay.
Yep. Still have one is a senior, and the other is in his second year of a 5-year program, because it's one that has 3 co-ops built into it. So he'll be well prepared when he gets out of college and has to go work full-time year round.
Yeah. Yeah. So how is the COVID affecting your family life for the last 3 months? Like, are they all at home, and do you have to entertain them and cook for them? And are they driving you crazy? Like my son.
So Michael was home for much of the summer because his school said, okay, we're switching to all online classes for the spring quarter. And he's since got back down. But the time that he was up here was really quite a gift, because we would not have actually had as much time with him since he had already moved off to college, as we did then. So there were some activities that we got to take part in, like playing tennis, and Jack got to go kayaking with him, and there were some good things. And the best part was that he's learned how to cook. So he was helping with cooking some of the meals.
Great.
But overall, I'd say it was really helpful for him because this was a whole new way of engaging in college level education. And he really prefers to have in-person interaction when it comes to his college classes. So moving to an all online was a big adjustment. It was very jarring for him, and he definitely didn't like it at first, but he persevered, and we were glad that we're able to help support him with having an environment where he might not have to worry necessarily about doing his laundry for a few weeks. So that was probably the part that really impacted me a lot, was having more laundry to do.
Yeah.
But
has Michael ever considered being a model? Because he's so handsome.
know if he's watching, but boy, that would be certainly might be a way to earn some extra income.
Yeah, I haven't considered, Yeah.
I do want to add a couple of things
about
parenting. I mean, obviously, I was working full time and trying to come home on time, but bear in mind that my parents were living with us at the same time. So Laura was very brave to take on Asian parents and their expectations and 3 kids. So hats off to her for that. Not only that,
一个福建人，一个上海人。Oh my God!
Yeah.
I say one Fujian人, one Shanghai人. Ren means person.
Oh, right? Yeah.
And with all that, she read to the kids every night, and I didn't realize how important that was until I read Andrew Yang's book and did some more research on that. And, but I would fake reading to the kids, whereas she actually read to them every day. That's an amazing feat in itself. Not to mention, now kids are gone. I'm trying to get rid of junk, and I'm looking through records like, oh my goodness, did you actually write every appointment down? All this stuff. It's like, if you look at some old calendars, it's like, oh my God, you were here and here. She would write down medical records and this shot and that. It's like, I would not have been able to do that. That's just not my characteristic. But I
What kind of data manager are you?
I know. Not that
Pay the
good.
pay. How about you, Dana? Oh
Anyway,
my gosh.
it's
So
good.
yeah, let us ask you some questions here, Ching.
Yes.
So
Oh, what do you have?
sure. So I'm curious to know how your like lessons for your students have been impacted. Have you been doing them virtually, or have you had to stop them altogether, or were you able to start up again?
Yeah, yeah, good question. All my students are online with me. So even I have one student lives one floor down. We don't see each other, so we just see each other on Zoom or StreamYard, like this capacity.
Yep.
Yeah, so it's a little challenge because playing the violin or playing the viola, mostly they're violinists. It's a very physical thing. You have to demonstrate. You have to adjust the way they hold the instrument. There's a lot of fiddling around, a lot of touching actually. So without doing that, it's really difficult to just say, hey. Sometimes they don't even position themselves right enough that I can see both right hand and left hand. Like I can see right now. You cannot see my right hand, left hand. So it's being challenged, and also because sometimes the students are like a Wi-Fi, like John earlier. I think that his Wi-Fi was weak, so his internet was weak. So sometimes you can hear the sound continuously. It goes stop and stop and stop. But I have to say, it's like better than nothing. It's better. It's like a way of at least I can give them some assignment, or I sometimes say, hey, you didn't practice much. Do you just want me to practice with you right now? It's fine with me, but you just have to let me know if you want me to have give you a lesson or you want me to practice with you. So it's a separate thing. Practice with you meaning you don't really have to come back with a perfect, assignment to play for me. I just practice with you. So stuff like that. So I think so yeah, so I have been teaching online. Yeah.
Mm-hmm.
Yeah.
And then what's it been like in New York? Like, do you get to go outside often? Are most people wearing masks? Are they actually trying to socially distance, or do you find that you still encounter folks like here in the grocery stores? There's still a lot of people that don't seem to get it. That they won't wear a mask, or they won't keep their distance.
Yeah.
I was ready to put my hand out the other day at Walmart because people were just getting a little bit too close in the checkout line.
Yeah.
Like, if I can touch you, that's less than 6 feet.
Yeah.
Can you give me space? And
Yeah.
let me stop
No,
there.
I think New York lately, I would say the last month or 6 weeks is better than before. Before you go out, and people are not that consciously yet. Now, in like I live in a apartment building, an elevator with more than 21 floors. So each elevator has a sign. You have to have a mask. Even when you go inside elevator, it says you need to have a 6 feet distance between two people. So basically, they encourage us just to have the most people in elevator, just 2 person, because it's not a large elevator that you can have 10. So people are very good. And then when I go outside, supermarket, they're pretty much all wear mask. And I think in New York for a while was so bad. Then I think recently New York actually sort of come back from the bad situation. I think people are more conscious about wearing mask, and wearing mask is not just for yourself. It really is a courteous to another person, or person who may get approached to you in one way or another. So I think people are being pretty good. Yeah.
Yeah, that's kind of like the question I had for you too, Ching. Like now, have you gone out actually, like to Times Square and stuff like that?
Oh my god! If you check my channel, Juhl Media, you'll see lots of. I go to Times Square. I used to go to Times Square almost every week or every other week. I lost count of how many times I've been at Times Square. I go there, and then sometimes there's nobody there. Sometimes I see a few people taking pictures, and so Times Square. I went there just a few days ago. Now the table is out. People can sit on the table to do enjoy, and chair and table is out. For a long time, nobody's there. It was totally, and it was very sad. Yeah, and lots of big billboards actually were down. Actually, so Times Square at nighttime, it was not as bright as before or as cheerful as before. Yeah, but of course, I think it changes. Some buildings are being fixed. So yeah, Times Square was very empty for a long time until like the last week, I would say, started to come back. Yeah, more people there. I would say 80% of people wearing masks.
Now, I know there's a lot of Asians in
Yeah.
New York City,
Mhm.
and I know with Trump constantly saying that the China flu or something like that.
Mm.
Now, do you feel a little feel a little strange? Do people are people reacting to that in a negative way, or is it just it had no effect in New York City because they're so
Mhm.
multicultural
Yeah.
already?
Personally, I have not experienced anything like that, like discrimination of Asian, because I don't really take subway. I don't even take Uber. Yeah, I walk on the street, go to the river, and I see other people. We live on the edge of Harlem, and so we actually are very comfortable being with people with color.
Mhm.
Yeah, I went
Right.
to many march, many protests, and then made some films about that, shorts about that. So to answer your question, I did not personally get any mistreatment from other people saying, "Hey, you're Chinese, or you go back to China, or whatever." Remember when we were,
Oh yeah.
you and I, when we were canvassing for Andrew Yang, somebody
Yeah.
cursed at you.
Yeah.
Oh,
Go
Yeah,
back to China.
that's true. You had a couple of pretty rough encounters, and I
But,
remember being worried,
yeah.
but yeah, I mean,
bit
listen to New
dismayed.
Hampshire. There's
But right, when you get into communities that are larger where people don't know each other, then it's so much easier for them to apply labels and expectations based on skin tone,
Yeah.
which is
yeah,
really, really sad.
it is
Because
sad.
if they actually knew the people, they wouldn't do that.
And
Right.
I expect some of that in New Hampshire.
Hmm.
Not that I'm not comfortable with it. I mean, I tell Laura when I encountered Trump fans with Six Flags coming out of their diesel truck, you
Mm.
know,
Yeah.
and but I expect New York to kind of lead this nation into how to do multicultural
Hmm.
right.
Right.
And now I know you have friends in like other buildings close by you. Do you guys still try to get together, even keeping a distance?
Yeah. We do Zoom party.
Oh, that's so fun!
Yeah, we can see each other. We don't have physically connection, and we also on WeChat a lot. So we
Oh,
have,
okay.
yeah, we have this network of my neighbors. Have like 15 people often like to get together on WeChat. Yeah.
You have to invite us.
Yes, yes. You do
Okay.
you still have WeChat account?
I don't.
Yeah, I do.
Okay,
Yeah.
okay, okay.
Yeah.
Yeah, I tried to put a post us talking on WeChat today, so
Okay.
I didn't find you. Yeah, I tried to like tag you. I didn't. So
Hmm.
anyway, and yeah. So I wanted to oh yeah, we're almost end. I wanted to say thank you so much for being with me. Um, ask me why I do this.
Yeah.
Why do you do this?
I don't need to.
So thank you. Yeah, well, I was just thinking, why am I doing this? So I actually the New York City lockdown was March 20th, and
Right.
I start my first episode was March 27th, the week after that. And so I started to meet Yang Gang. I think Jack, were you in my first episode or
Yeah,
you were
I think
yeah.
so.
You were in, yeah, you're in a couple of episodes already. So
Right.
so I did 8 weeks of just talking with the Young Gang because I really miss them. We don't have any events. I cannot go, shoot stuff. And so the idea is to reconnect with Young Gang. The idea is to visit each other. The idea is to just talk because we all stay home doing nothing. I mean, not doing nothing, but a lot of people are doing nothing. I do. So we it was the early lockdown was really hard, I think.
Oh yeah.
After a while, you kind of get used to it. It's like
Mhm.
you get used to doing nothing. So anyway, then very soon, like 3 or 4 weeks after the Yangan thing, and I start to talk one-to-one because I want in-depth of discussion about whatever it is. So the some of the reason is because I want to promote, say, a musician. So I want to listen to their music and then promote them as a musician, or filmmaker or whatever the field it is, and
Right.
politician.
Or like
So
Henry.
Henry, because he's running for, a politician
Yeah.
for Florida.
Yes.
Commissioner.
Yeah, so lots of different people, and I featured a very interesting UBI professor. What's his name? Carl Weidequest.
Yes.
Carl Weidequest. He's a UBI professor.
I watched your was it last week? The woman that I didn't finish her podcast. I mean her YouTube video yet, but
Oh, which one?
I forget
What
her
does she
name
do?
now.
What does she do?
It's slipping my mind now.
Oh, okay, that's okay. Yeah,
But-
so I do Monday, Wednesday. Yeah, I've been
Okay.
consistently doing Monday, Wednesday, occasionally Saturday. Yeah, so like say, next Monday, I'm interviewing with film an actress. She's doing a Zoom play.
Wow.
She's directing a play, and it's very interesting. It's on Zoom, so we're gonna talk about that. And then
Okay.
you know what? Who I got? I got Paget. I got Paget.
I can't believe that. I am so gonna watch that.
Yeah, I got Paget. So it's going to be. It's not 100% confirmed yet, but I'm projecting it's going to be on July 27th.
That's right.
Yeah,
I saw that.
Yeah, and then the next Wednesday
Wow.
I'm doing a composer. Yeah. So
Oh,
You're
cool.
doing good stuff. I really appreciate what you're
thank
doing.
you.
So many people.
Yeah, thank you. So yeah, well, any other things you want to talk about?
No, I
It's
do
almost
look forward
over.
to seeing you in person sometime soon.
Yeah,
Oh.
I know.
We might be heading down to Philly,
Really? Oh, okay.
so we might stop in again.
Yeah, stop by. We'll
Okay.
kick Sean out of his room, and you can stay in his
No,
room.
no. We're just stopping.
Sean is gonna be home for a while, because
yeah.
Julia is not. The dormitory is not gonna open, and he doesn't
Yep.
even want to stay in the dormitory. So
Ah,
yeah, but
pretty good too.
can you believe if he goes on the street, like rent a room? It's very expensive.
Yeah. Oh,
I mean, it's
wow.
about $2,000 a month.
That's insane.
Yeah, yeah. So
All right.
well, I wish you the best for your operation.
Thank
and-
you.
Yeah,
I'll text you after.
yeah. Please.
Okay.
Yeah. Hope you don't experience too much pain. I'm sure it will be painful though.
Oh yeah.
Yeah.
All right.
Yeah. Thank you so much, Laura, for
Thank you.
joining us. And
Lovely.
yeah,
Thanks.
that was fun. And I hope to see you in person very soon.
Mhm.
And everybody there, hey Al, you're there. You're late, Al. Our audience. Al is a youngin.
Oh,
Hey,
okay.
thank you, Al, and thank you guys for coming and for watching us. Thank you, Nick. Thank you, Peter. Thank you. Another person's name is Kala. I can't see anything. Sorry. Is this your friend? Kailani. Maybe she's
Hey.
your friend.
Caitlin.
Yeah, Caitlin. All right. Anyway, thank you so
Okay.
much. Thank you for coming. Subscribe my YouTube channel. If you
Oh,
have
definitely.
not, please.
All right.
I'm pretty sure I have. All right, I'll have to double check that.
Double check. Double check. Okay. All right.
All
Good
right.
night, Jack. Good night,
Bye,
Laura.
Ching.
Thank you so
Bye.
much. Yeah. Good to
Thanks.
see you.
Good seeing
All
you
right,
too.
see you too.
Bye.
Bye.
Bye.